So, Andrzej, first of all, welcome and thank you for being with us this afternoon. I hope you had a chance to listen to our panel discussions where we had each of those recommendations. We identified why that was so important and what it actually meant for a new framework. Andrzej, what are your comments when you heard all the messages about the recommendations?
Good afternoon, everybody. It's a pleasure to be in this meeting. So I hope you can see me because it's I'm connected.
We can see you and we can hear you, Andrzej.
Oh, okay, so this is a huge harvest of the knowledge this project was able to create. I really congratulate the all co-creators, because I think it's as usual in such harvest, it's important to recognize that every individual, I think, voice was heard and some kind notified, and you brought with this recommendations. And I'm sure that the number of those recommendations, first they fit purpose, and the second they are available, for our policy development. I really feel, the messages passed from the panel, the last one about we say that we would like to allow the access to patients for the right diagnosis and treatment, but it was reminded us by young generation that we want knowledge travel, and this is knowledge travel easier than patience, and we should continue to push this agenda. Unfortunately, the COVID also stopped our new effort for support, exchange of expertise through the physical presence of clinicians, moving from one country to other, from center to center, bringing the knowledge, teaching new technologies, helping with the diagnostic tools or ideas how to organize the care. But we hope that this shortly COVID situation allows this part of year-end's work continue. The second important message I heard was about the golden age of networking. I fully support what was said by Vicky, by Mauricio. It's clearly the year-end is the best example. This networking makes sense. It's helped us to develop things. It's give additional value to the patients, to the clinicians, and we should continue. But of course, as any system, year-end also has to be carefully assessed and what. So Court of Auditors colleague mentioned the report and the recommendations. One of them was about the national contact points and strengthening access to the knowledge information about rare disease treatment, about year-end's work. This is what we are doing. We try to push this agenda, and we continue to meet national contact points, support them with all kinds of again knowledge and excellence, how to do this better for patients. We announced also the assessment of the regular framework. Cross-border healthcare directive is an important base for the ERS, but not only, it's important for the patients' cross-border healthcare. So we will see, what this assessment will tell us, what has to be addressed for the future, what should be changed. Additional issue is relations between different level of governance and access and work. At the European level, I think we are able to establish this 24 networks, over 900 centers already joining the hundreds of new are coming as affiliated partners, new members. So hopefully soon the whole assessment process will be finished and they will join the networks formally. It will allow, spread the networks, European reference network across Europe, but of course without, involvement of regional, national, and sometimes even quite local involvement on the hospital level. It will not improve. So we need this, and I think it's important. This also is addressed in the recommendation. So we are going to push, this through the joint actions, which will be funded through the new health program. And it's also important to say the new health program, EU for Health, is also having ERNs as one of the flagship we like to support. And I think it's important that the resources budget is there. And let me also mention that something which I think Jan addressed in the beginning of this debate. We need also evidence, and we need clearly assess what we are doing. So, as you know, by law, by legislation, the European Reference Network will go through the full assessment, in-depth assessment of performance in next 2 years. In 2022, the framework is under development, and we will see, how we can see the system is working also from this performance point of view. I think it's and the last thing I would like to say. We should not forget about the different regulatory developments. We have clinical trials regulations coming, in force beginning of next year. So we have to use this opportunity for the cross-border multinational studies, which are coming with a quite established IT system to support it. But we need knowledge, again, we need trainings, we need all systems in place to function. HTA, Health Technology Assessment regulation, is under discussion in the Council and Parliament. Hopefully get soon to the final. Orphan and pediatrics regulations is now under, after evaluation. Now we start to propose potential changes. We address them in an inception impact assessment end of last year. And finally, by end of this year, we would like to propose European health data space. And I think I will refer to Anna. She said about federated data. This is one of the concepts we like to explore and bring, everyone who can produce data, quality data, share them with others to produce better results. Let me conclude with I think something which is in the bottom of my heart. I am in this journey with you since almost beginning. I had a chance to co-create the 2008 policy by the European Commission. I was able to work on the European Reference Networks development. But what is important, I think that the key message in the end is that behind all factors, successful factors, are people. So let me address it with my last point. Big invitations to everyone who is contributing to this development, to patients, clinicians, researchers. I would like to address especially European Reference Networks coordinators, hospital managers, who are trying to help and push this agenda together with us. Finally, policymakers on different levels, national, European level, and of course to all of you. And I think this journey is not ending. So I will invite you to continue and be together, because only networking is going to make us working better in the goals you establish in this great project. Thank you very much.